First is identify the patient, explain the purpose of the procedure, and perform hand hygiene and provide privacy to the patient. For our assessing, I'll be assessing the thorax, particularly in the posterior part of your thorax and also the lungs. And for this assessment, I need to inspect, palpate, percuss, auscultate, and also listen the breath sound. Let's assume it's completely confidential between me and the attending physician that I'll be referring it. Get a patient gown and give to the patient. So the patient is already changed in a patient gown. So first assess the posterior thorax of the patient. So for the first one, I'll be inspect for the shape and configuration of the chest wall as well as the position of the scapula. Scapula I will be also inspecting for the accessories muscles and the posterior of the patient. For the next one, I'll be palpating for tenderness and sensation. I'll be also inspecting for the temperature. I'll be using the dorsal part of my hand. As for this scapula, it is asymmetrical and I have seen any protrusion of the shoulder, and for the scapula is equally horizontal position in the posterior back of the patient. Also, I have seen signs of darcosis, cyclosis, or any misalignment of the spinal cord. When I asked the patient to breathe in, I observe she has used a shoulder as or accessories muscles inhale and exhale. The temperature it is equally bilateral as the I observe and touch of the patient's back using the dorsal part of my hand. It is warm, it is not too hot. And I have and the client also said that she has no pain. When I palpate it, I observe it and she has no feel any tenderness. Next is I'll palpating for the perimetus and I'll be using the ulnar part of my hands. And the patient say it 99. I'll be observing for the chest expansions and for me to observe that I'll be putting the thumb on the T9 and T10 of the patient and I'll be observed for the movement of my thumb. For the parameters, I observe that it is symmetric and I can feel vibrations when the patient say 99, so there is no presence of vibration as I palpate in this part and up until this. Next one, I percussing the intercostal space of the patient. So I have observed that resonance, the dullness and flatness as I percuss. I'll be percussing and performing the diagrammatic excursions and I just use the pen and also the measurement. The next one of the assessment and the last part are be auscultating the breath sound of the patient and observe if there are any possible or if there are many presence of the normal result and I'll be using the stethoscope.